We're going to do a little visit down the genetic train here, the hereditary factors, just to review. Much of this you probably remember, or at least it will be familiar from your biology classes. But genetics is important in understanding the concerns that prospective parents may have depending on their family background and their personal health issues. So we're going to just do a review of the genetic issues and the genetic side of life here. We'll start with the autosomal dominant trait. This is where one parent has the dominant trait, and there is a 50% chance the offspring will have the normal genotype and be disorder-free, and there's a 50% chance the offspring will have the disorder. It's called a dominant trait disorder. So when you see a dominant trait, know it's a 50-50 chance of disease or not disease. Examples of this would be myotonic muscular dystrophy and Huntington's disease. I'm used to calling it Huntington's chorea, but they call it disease now. The next type is the autosomal recessive inheritance. That's, if you remember from biology, that's where you have tiny X's and big X's, or tiny, well, it's tiny X's and big X's basically. This is where both parents carry that recessive, the tiny X gene. They carry the recessive gene, and this is going to give you the 50-25-25 chance. There's 50% chance those children of those parents will be carriers. They will have that recessive gene in their genetic makeup. There's a 25% chance that they will have the actual disease. The two small x's got together and now the child has the disease. And there's a 25% chance that they will not be affected in any way. They have a completely normal genotype. Examples of the autosomal recessive are sickle cell disease, which is quite common in OB, and cystic fibrosis, another one that's quite common in OB and the pediatric area. Next, we'll talk about the X-linked inheritance disorders. These are the disorders where only the X chromosome will have the gene on it. When you think of that, you realize that both male and female have the potential to have that X chromosome with that gene on it, because both males and females have the X gene. The X gene of the male, if he has that chromosome on it, he has the disorder. It acts as sort of a dominant gene in the male. It's not offset by anything because it's all it is that X. It's got the problem attached to it. The male will have that problem, that disorder. The X gene of the female is a 50-50 chance of having the disorder. Since they have two X chromosomes, depends on which one's the dominant gene, and so there's the 50-50 chance that the female babies will have the disorder or not. So we'll talk now about the X-linked recessive inheritance specifically. Most X-linked disorders demonstrate that recessive pattern of inheritance that we discussed a few slides ago. If you remember, I referred to the two small X's becoming then the characteristic will be exhibited if the two small x's get together. Same way with the X-linked recessives. There are more affected males than females because all of the genes on the man's X chromosome will be expressed. So if he has that X-linked trait, he's got at least an expression of the disease, the disorder. It's in various levels of severity, but it will be expressed somehow. The female will usually need two abnormal X chromosomes to exhibit the disease. And again, reflect back on that recessive non-X linked. It's the same thing. You got to have two together to have the disease. And then you'll have, if you have one normal and one abnormal X chromosome, they're carriers. And then of course, if they have both normal X, they don't have anything. There is no male-to-male transmission because there is no X chromosome that goes from the man to the son. They only transmit that Y chromosome, so men cannot give it to their sons. However, because their daughters get their X chromosome, they can transmit it to their daughters. Well, they will. They will, because that's all they have is that affected X chromosome. So it goes to the daughter, and the daughter will at the very least be a carrier. And certainly if the mom also has that X-linked disorder, the daughter has a chance of having the disease as well. Again, it's not 100%, depends on how they all line up. Think of that recessive trait again. Examples of X-linked recessive inheritance disorders are the Duchenne muscular dystrophy, and then color blindness is a biggie, and then hemophilia A and B is, of course, a severe one. So let's now talk about the X-linked dominant inheritance disorders. This occurs when the male has an abnormal X chromosome or the female has one abnormal X chromosome. With that affected male, as you can probably know by now, all of his daughters but none of his sons will have the disease, because that's X chromosome either has it or doesn't have it, okay? The affected female, both sons and daughters have that 50-50 chance, because there's a 50-50 chance of which X chromosome will get transferred to the son or the daughter. Many X-linked dominant inheritance disorders are lethal in males. Females have a second normal X gene that offsets the effects of the dominant X to some extent. So men, if they have this disorder, it doesn't have anything to offset it. Women, we have the dominant disorder, but we also have one that is not affected. We don't get it quite so severely. And these are very, very rare. Examples that you may hear of in pediatrics with this are Fragile X syndrome. And then this was a new one I saw when I was looking up items up. It was oral facial digital syndrome type 1, and it should be named after some person. I don't know why no one named that after themselves, but it's a descriptive name of oral facial digital syndrome type 1, and that gives you an idea of what's affected in the patient that has that.